Okay, I think that is enough time. And let's start. Let's start in the name of the Almighty. We're just going to share the PowerPoint presentation for you. And keep in mind that the PowerPoint presentation is just for references. It's basically me and my voice that will be teaching you. So don't focus too much on the PowerPoint presentation. What I need you to focus on is asking questions. Everyone should be willing to asking questions. You can type your questions and I shall read them out loud and try and answer as much of those as possible. All right, everyone? Okay. All right, everyone, let's begin. And today's topic is basically, it's all about your communication skills. Okay. So what exactly do we mean when we say communication skills? So by communication skills, we mean that how do we handle a particular situation? In today's presentation, what I'll be doing is I'll be sharing two scenarios with you. They are self-made scenarios. They can come in PLAB-2, they may come in PLAB-2. I wouldn't be too sure of them. It's just two random scenarios, that I made. So the first thing you need to learn about PLAB-2 is just as we spoke last time, if anyone's attended my last webinar, we discussed that the most important thing in your PLAB-2 examination is going to be your interpersonal skills. Now, in every single station, the interpersonal skills, you get scored out of 4. So it's 4 marks for your history taking, it's 4 marks for your interpersonal skills, and it's 4 marks for your management. What today's session is about is the fact that how to incorporate your interpersonal skills into the management and also into the history. There are many things that many people do wrong on a regular basis in PLAB-2 exam. Most of the times it's due to anxiety. Other times it's just the suddenness of the question. You have a patient in front of you, they can ask you anything at all, basically. So if they ask you a question that you were not expecting, now that is a problematic scenario. Now you are troubled. Okay. So the first scenario we're going to discuss is, this is just a basic slide, the importance of interpersonal skills in clinical setting. We're going to come to that. We're going to come to everything that has been mentioned on the slides in between. Okay. So, and if you have any questions, everyone can type their questions and I'll make sure to get to each and every single one of you. Okay. So the first thing you need to do in a station is to be very well oriented. You need to read your station guidelines. Now, every time you're going to attempt PLAB-2, let's hope it's the first and the final time for everyone. Every time you are standing in front of a station, they give you a few minutes to read your station, to really understand the statement of the station. So what happens is you're standing there, you're really trying very hard to focus, and what you're missing are the cues. Now, most of the people, what they do is they miss the cues. What are the cues? Cues are little pointers that the GMC has placed inside that statement that you're reading. Okay. So the first thing you need to do is you need to scan for the important information in a station. So where are you? That is important. You're in GP surgery. You're in accident and emergency. You're a junior doctor in oncology. Now, the first line of every station, the place where you're at, that defines how you are going to introduce yourself. Because if you go inside and you tell your department wrong, that does not reflect good on a junior doctor. Like the patient's going to be like, you don't know your own department? Doctor, I came to the GP surgery. Why are you saying oncology? Okay. All right. So the next thing you need to do is after you covered the where are you, who is the patient? Now, it's good that you learn the name of the patient. It helps you, if anything. It helps you, if anything. Okay? So, so the second thing you need to do is you need to learn who the patient is. It's always good to remember the patient's name. For example, you go inside, you address them by their name, sorry. And that is, that just reflects good on you, that you remember the name of the patient, you remember why they came here. Okay. All right. So could you please just, guys, could you give me just 1 minute? There's some issue with the screen sharing. Really sorry about that. Okay, I hope that's fine. Okay, so sorry about that. So you need to learn the name of the patient, you go inside. I'm just gonna step it up a bit because I feel bored. So you go inside, you talk to the patient. The first thing you do, you address them by their name. Now, sometimes, certain people, they forget the names. What you can do is you can confirm the name as well. It's okay to confirm the name. I mean, it's not really, written in stone. It's not really etched in stone that you need to learn the name always. So you go inside, you introduce yourself. So the last point of this presentation would be the questions to avoid in this, in every station. There are certain things you need to avoid. So the first thing you need to avoid is to be repetitive. Okay, by that, I discussed this in the last webinar as well. If someone, if someone was here during the last webinar, they must know it by now. So the first thing you need to do is here, you need to introduce yourself in some unique way. Okay, everyone's going to say, hello, my name is Dr. Daniel. I'm a junior doctor in the department. How may I help you? Or they're just going to say, hello, how may I help you today? My name is Dr. This. Or hello, may I confirm your name, please? May I confirm your age, please? There is nothing wrong with that approach, but you need to, just make it a little bit, unique when talking about it. Yes, Dr. Shariar, could you please type, in the chat? Okay, so the next thing you need to do is you move on with the station. Now, let's have an example station. So imagine that you are working in GP medicine, okay? You're in a general practice with a special interest in medicine. Let's just call it a GP medicine. You're working as a junior doctor in GP. Okay, so you're working as a junior doctor in GP. A patient comes to you with the complaints of acne. Now, that is a very common complaint. Okay, most of the women, most of the men, most children, most young people, they get acne. There's nothing wrong with it. But what you need to realize in this station that the patient is not talking to you as much as she should. Okay, so the point here is that sometimes a patient may come to you and the patient will not be willing to talk. So what do you do then? You deal with it. How do you deal with it is what this webinar is all about. So the patient came to you, and once you go inside, she will just say hello. She will not be making eye contact with you. She will not be willing to talk as much as the other stations you've been in. Now that poses a problem. Now the problem here is, how do you extract your information? Because the patient is not exactly a talkative person. Maybe she's depressed, maybe there's something going on. So you need to find that out first, and then she might be able to give you some information about why she's here and what she's worried about and stuff. So the first thing you do is you start taking a history, and you notice that the patient is not making eye contact. Now that is a problem. Now there are two kinds of people. I've met a lot of PLAB-2 aspirants, and there are always two kind of people I've met. The one kind is they're not very good at eye contact. The other kind are the ones who tell me that we keep staring at the patient. There is too much eye contact. Okay, so what you need to do is you need to find a middle ground somewhere in between, because too much eye contact is, it's creepy. I don't have any other words to say that. It's basically creepy. So first you start off with the history. What do? You start off with introducing yourself. You move on with the station. Okay, so what brings you to the GP practice today? And she's gonna say, doctor, I have acne. Okay, so you go on with the standardized history, and you notice that the patient is not looking at you while she's talking. She answers in a yes or no fashion mostly. She's not exactly willing to talk, and she's generally unresponsive for the most part. So you notice this, but how do you point it out, without being rude? You point it out by saying, now you know that the patient has acne, okay? So the patient must, deal with social stigma here somehow. So now you start with something other than the station you're dealing with. You went inside thinking that this was a standard station of acne treatment. Now you go inside and the patient is not talking to you. And that is now problematic, because if you can't take a history, you can't exactly put on the management. And if you can't take a history and put on the management, that reflects on your interpersonal skills as well. So the way to go about it is you ask her that one golden question. What is that golden question? You seem tensed, or let's call her Miss John or Miss Susie. Okay, Susie is nice. So Miss Susie, is there I've noticed that you're reluctant to share information with me. Why is that? You can say that, or the better thing what you can do is you can ask her about how has the acne affected her life. Obviously the second thing that I just told you, that's better. Okay, instead of directly asking the patient, why aren't you talking to me? I need you to talk to me. Okay, so what happened was, by asking the first question, you were rushing her. What the GMC wanted to test in that particular station was the fact that in an exam setting, under pressure, how do you hold yourself? Sorry, how do you hold yourself emotionally? How do you deal with stress? Because the patient in front of you is not giving you information. You only have a mere 8 minutes, and the patient not talking poses a problem. Now, most of the people, what they do is they start rushing the patient. Can I ask you a few questions? Okay, so how long ago did it happen? How long has this been going on? Okay, and have you taken any treatments for it? She's not willing to talk. She's not looking at you. She's tense. She's nervous. Maybe it takes a lot of effort for a person with insecurities to come to a clinic and discuss their very personal things about their life. Okay, so you need to acknowledge that. So the first thing you do is you make eye contact. If the patient is not making eye contact, you make sure she does. You look at her on and off, on and off. You keep looking at her. At one point, she will start making eye contact with you. She'll start trusting you. It's all about giving the patient an environment that is safe. Safety comes first. The patient comes first. The patient is your priority. Okay? Now, the interpersonal skills, I don't know why so many people are troubled with interpersonal skills. The problem here is all of us, all of the doctors, we deal with a lot of patients on a regular basis. So we are implementing our interpersonal skills on a regular basis. The only thing different in PLAB-2 is that there is a time limit and you are under stress. It's basically replicating the same thing you do every day in those 8 minutes, but under a tremendous amount of stress that you don't mess it up. Okay? So just think of it as a very regular day at a clinic, at your hospital. There is a patient, you're going inside, you're going to deal with the patient. Don't think of it as an exam. Okay? So the patient is presented to you with acne. What you're going to do is you're going to try and give her a certain amount of safety, a safe space. Okay? Maybe try leaning forward a bit. That gives the impression that you're listening actively. You're listening to every word she's saying. You're listening with the intent to solve. Okay. After the eye contact and the safety, there has to be an appropriate distance. The appropriate distance means, for example, you're dealing with an angry patient. Okay, so in case of dealing with an angry patient, you need to maintain a certain amount of distance from the patient. Okay, it's called the safe distance. We call it a safe distance. Imagine you're fighting someone and they're taller than you, they're stronger than you. You don't want to stand too close to them. It's just natural basic instinct. Okay, so the same rule applies here as well. So what you do is you maintain an appropriate distance according to the situation. If it is an angry patient, you lean just a little bit backwards. That shows that you're trying to save yourself. That shows that you're reading the situation properly. You have read the situation and you're responding to it. Okay, same goes for a patient that is depressed. Same goes for a patient that is, that is troubled. Okay, you lean forward just a little bit, not too much, because if you lean in too much, that's just uncomfortable for the patient. That might become uncomfortable for the patient. So just a little bit forward, trying to show with your every move that you are actively listening to the patient. This is a part of active listening. Using your hands is another gesture. Try and use your hands while talking. Don't just let them, sit beside you. Sometimes I have seen students, they have their hands resting on their laps and they're talking and they're talking and they're talking and they're talking. It gets boring. You need to make the conversation interesting for the examiner, for the patient. He's going to test 72 people in a single day. Now imagine 72 boring conversations, 8 minutes each. You need to stand out. You need to make yourself, different from everything else. Okay. So moving on with the acne scenario. So the appropriate distance is done. The second thing is the importance of time. Now I will come back to time in just a few minutes. Just let me explain the safety part again. Sorry, I'm not feeling quite well health-wise. So the safety part. There needs to be a very safe environment. Imagine this acne scenario, okay? The patient has come to you with acne. Once you start talking to her, you realize Maybe she tells you and maybe you realize. Most of the times she will tell you. She will tell you that I have had this problem for the past few years. It's been a long time. Okay, so I've had this problem for the past few years. I've been very uncomfortable. I don't like to go outside. I have been missing work because I do not want to go into the office because people stare at me, or I think people stare at me because I have acne on my face. Now, this is a problem. The acne is interfering with her life. Okay, so the problem number one was acne itself. The second thing was the impact the acne is having on her routine life. All right. So she says that she's not been going into her workplace, and she's not been comfortable. She's not comfortable talking to people. She's not comfortable facing situations. She's not meeting her family. That indicates that she might be depressed as well. So you've got three problems now. You've got the acne, you've got the social stigma, and now you've got depression. I'll tell you a fourth problem that can arise with it. Now, what can happen is she might also tell you that my superior has been calling me, and he or she has been telling me that you've not been coming into work regularly, you've been coming in late, you've been missing work a lot these days. So, if you keep on with this behavior, we might have to let you go. Now she's at the brink of losing her job as well. So now you realize that once you were standing outside, the only thing you knew about the station was that this was a simple case of acne. You were an FY2 in a in a general practice, and there is a patient who has come to you with acne. Go and talk to the patient and manage appropriately. So now you go inside, you start taking the history. There is not just one problem. There are associated problems, and there will be other problems coming in as well. She's not having good relations with her mother. Her mother complains. She's going to tell you that my mother is complaining that you don't, you don't show your face. You don't meet me. You don't meet with us. Her relatives, her friends. She's going to leave her friends as well. She's going to tell you that. She's going to tell you each and every single bit about her life only after you get her comfortable. How do you get her comfortable? You be empathetic. Empathy is the only way to break this kind of station. Now, talking about empathy, I just need to mention a few points. Most of the people, when they are acting empathy, okay, focus on the acting part. They are acting to be empathetic to the patient. Why can't this come naturally? That is why in the beginning, I said, consider it as a regular day in your clinic. Because once you start treating this like an exam, it becomes quantified. It becomes a matter of passing or failing, and these many marks, and these many marks from here, and these many marks from here. Doing that will not allow you to actually focus on the task at hand, which was treat the patient and not just perform the station and go out. You need to be able to manage the station as well. Okay, so fake empathy will not get you anywhere unless you are an amazing actor. If that's the case, then go for it, act away. If not, then you need to genuinely feel empathetic for the patient. Okay, so you need to provide the patient with a safe environment. The environment of safety is basically the part where you let the patient know that you can see that she is under distress. So, okay, so you've told me that the acne has been affecting your life. I'm sorry to hear about that. I can see that this is problematic for you. I can see how that would affect your life in a very negative way. Okay, would you like to tell me more? And she will tell you more. She will tell you about the bad relations with her parents. She will tell you the bad relationships with her friends. She will tell you that her boyfriend broke up with her. Many, 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 many things. Now, most of the students, when they are sitting in that station, they do not want to hear about all her family problems. They're there for 8 minutes. What they want to do is they want to just take a history, you know, do some ideas, concerns, and expectations, give her the management for the acne, and just roll out. This is a station. You're here to pass the exam. Now, let me tell you the golden rule of passing PLAB-2. I learned it the hard way myself. You do not need to complete your station to pass a station. Let that sink in. It's not necessary for you to do the whole history, the whole management thing. Sometimes you will be short of times. You will be short of time. Sometimes you will get a case like the one we are discussing right now. In this case, the only thing the GMC wants to see is the fact that are you good with the patients? How good are you and making the patient comfortable, so that in real life, while working in the NHS, if a patient comes to you with depression, you can spot the depression, you can manage the depression, you can pinpoint it, and yet do not make the patient uncomfortable. So the whole point of explaining this again and again and again and again is to make you guys learn that do not make the patient uncomfortable. If you are in a rush to just finish your station because that is your task, that is the task that you were given outside the room, you're going to fail the station. It's as simple as that, because all of this was just a ruse to get you inside feeling all comfortable talking about acne. You know, many students told me, they said, we read acne and we were going inside, we were just suddenly, you know, revising the names of all the medications, we were revising the name of the patient. It's like, okay, her name is Susan, her name is Jane, we're going to go inside, okay, so we're going to tell her hi, and then we're going to take this history and this history and this history, and once we're done taking the history, she's going to be very, you know, compliant. How can you assume all that? You can't assume that. Okay, so the GMC likes to play with your minds. It's been a long time since then they've been arranging PLAB-2. They're bored. So what do you do when you're bored? You mix things up. So the GMC has started to mix things up. Okay, the next thing you need to do is you need to acknowledge the patient. Okay, how do you acknowledge the patient? After every one or two, if you are the explaining, if you are at the stage of your station where you are the one explaining. So what do? You stop and you ask. It's called the chuck and check maneuver commonly. It's basically, you say one or two lines and then you, okay, are you with me? Okay, great. And then you say one or two more lines and then you're gonna ask the patient, okay, do you understand that? Okay, do I need to repeat myself? Okay, that's great. So you keep the patient in the loop. You do not want to be talking at 120 miles an hour speed and expect the patient to understand. So what you do is you give a 3-minute lecture about how to manage your acne, how to manage your diabetes. And at the end of it all, what happens if the patient asks you, doctor, I didn't get a word of that. You were talking too fast. Your IPS is done. Okay. And they do that, by the way, they keep doing that. So in this particular case, let's stick to this case first. Okay, so the patient is also going to tell you that she has been talking to a few friends of her, you know, she's been talking to the local gypsy or whatever, and the gypsy has told us that, you know, her eating habits are the reason for her acne. She should not eat chocolate, she should not eat oily products, she should not be eating, you know, meat and stuff. So here comes the problem. So this was the fifth problem. Okay, so now we have 5 problems in a station that was supposed to be a very simple case of acne. Okay, that's good. You're sitting there, you're all tensed. It's already been 4 minutes, and all you've done is taken your history, and half your time is gone, and now you're tensed that this woman is not giving me history. You're basically angry at this point. So how do you tackle with this? You take a very good history. You give her time to recover. You give her time to trust you. You build your rapport. Okay, in this station, it's all about building your rapport. It's about building your reputation to the point that the patient trusts you. You let her talk mostly. You do not talk faster and faster and faster, just trying to, finish the station as soon as you can. No, you don't do that. You let her talk. You let her, vent it out a bit. It will waste your 4 minutes, in your opinion, but it will, benefit you towards the end, because now you know all the problems. There might have been a problem if you are rushing her, if you're rushing the patient too much. There might have been something that you missed. There might be something that you've forgotten to ask. Okay, so by letting her talk, by letting the patient take the lead in that station, you have made sure that you now know a complete history. You have a complete layout on what the major problems are. The problem was acne, but there are other problems as well that are caused by acne, and they are much, much, much worse. Okay, so you thank the patient, because in a young person who is dealing with social stigma, in a young person who is being persecuted, in a young person who is not willing to go outside her house, she developed the courage, she took the time, and she came to your clinic to ask for your help. That takes courage. You need to acknowledge that. Okay, so thank you so much for coming, with all these problems and discussing them with me. I know it must have taken a lot out of you. Okay, just by acknowledging this is empathy. This is how you show empathy. It's not about, I'm very sorry to hear about your situation. No, it's a very typical phrase. Everyone uses that. Why do you want to use that? I can understand. I can see that it took a lot of effort to come out of the house, to come out of your building, to come out of your workplace, and to come and see me and tell me all your problems. It must have taken a monumental effort to discuss all your personal problems with me. I thank you for trusting me with that. Thank you for coming. Now let's help you. Let's, get you on the right path. So now comes the time for management. You don't do ice in these kind of stations, by the way. Your ice is basically you showing your empathy. You don't ask her, you've come with acne, so what do you think it is? Of course she knows it's acne. She's come to you with acne. And then most of the people, they go for concerns. So are you particularly concerned about anything? You know, if I was the patient, I would say, yeah, doctor, my life is ruined. I have acne. I can't go out. I don't meet family and friends. I'm about to be kicked out of my work. Of course, I'm concerned about stuff. And then the expectations. What do you want us to do for you? Doctor, I want you to treat my acne. Wasn't that clear the first time? Okay, so it's just common sense. PLAB-2 is common sense. So what they want to do is they want you to implement your ice in different ways. This is ice. Empathy in this station is equivalent to ice. Okay, I hope that's clear. So you have thanked them for coming, then you reassure them. How do you reassure them? You make it seem like a common thing that you deal with every day. All right. So the point is, Susan, that we get acne. Acne is a very common problem in today's times. We see a lot of patients with acne these days. Personally, I see a patient coming to me with acne twice a week, thrice a week. It's a very common problem, and there are many treatment options available. Okay, so there's one thing that I forgot. Uh, it's it just shows that you care. It's one more thing that you would want in your arsenal for these kind of stations. These kind of stations are tricky. I wouldn't lie to you. These kind of stations, I don't like these kind of stations because it's very hard to identify what they want from you in these stations. You know, Most of the stations is just straightforward history management at your IPS. These kind of stations, they really test you. And most of the students, they fail in these kind of stations. Again, it's the lack of information. It's the element of surprise that the GMC has prepared for you. You go inside thinking it's a simple station, and then you walk inside and it's pandemonium. So most of the people, they are not able to deal with that. Those who are, they barely pass. Very few people, there are very few people who have actually, scored good, great marks in these stations. So I was talking about one more thing. Okay, so there's also one other way that you can show your empathy. One thing is that the patient is female, all right? So the patient might be comfortable talking to a female doctor. So you might give her an option. How do you give her the option? You give her the option by asking her, okay, so she's not telling you everything, okay? We discussed that. She's not really engaging with you in the beginning of the station. So what you do is you say, okay, if you're not feeling comfortable sharing your personal information with me, if you're not comfortable, sharing your personal life details with me, we can always arrange a female doctor for you. Would that be something that you might want? He will, of course, say no, but that just shows again, it's all about showing that you care. So you care so much that you're willing to leave the patient to another doctor. You're willing to, you are so invested in the patient's comfort that you just, you would go to any lengths to just make the patient comfortable. And this is IPS. This is empathy. Of course, all of us know that you do not care about that particular patient or any patient for that matter, but it's nice to think that you do. Okay? So, okay. One more mistake that the students make in these kind of stations. In the stations for depression, in the stations for anorexia, in any psychiatric stations, in a station with schizophrenia, and name a station really. In every station, there seems to be an abundance and overuse of the line for confidentiality. Everybody overuses the confidentiality line. So what happens is there is a patient with a psychiatric history, and he is unwilling, he is reluctant to tell you about that history. So what most people would do is, the conversations here, they are confidential, so you can tell me everything. And the expectation, I think, is that by saying that one magical line, the patient will start, revealing everything about himself. That is not how this works. This will never work in any station. You don't just put in the word confidentiality and expect the patient to give you a full history all on his own. No, that does not work. So what you can do in these kind of scenarios is you don't rely on the confidentiality line. You use it only when it's necessary. Like in a proper case with schizophrenia. Why would you like to use this line in schizophrenia? Because a schizophrenic patient is the least trusting person in the world. You need that patient to trust you. So in the schizophrenia scenario that has been coming in the PLAB-2 exams, the guy, he will be constantly saying, the police are after me. They are right outside. They are planning against me. Are you with the police? So now you need to decide, you need to amplify your level of trust, his level of trust in you. So what you do is then you use the confidentiality line. You say that by law, I am bound to keep want to tell me, you can tell me, and by law, I cannot tell the policemen who are standing outside. Okay, great. Okay. Voice check. Everyone hearing me? Great. My voice good? Okay, so coming back to the station at hand. Okay, so the acne patient. There is one thing that I was forgetting. I'll just come back to it in a few minutes. Okay, so now let's come to the management of the acne station. This is a very nice station. You know, this is a very challenging station. I like the station, but I don't like how you approach it. I don't like how people approach the station. Anyways, sorry about that. Okay, so let's come on to the management for this patient. There is a simple thing that I call the 1 minute rule. Okay, so what is the 1 minute rule? I like to think of the 1 minute rule as the time you take to get your head around things, to wrap your head around things. Why is it important? It's important because, as we've discussed in the acne station, we are having multiple problems. Now, what you would like to do, what any student would like to do in this station, is they would like to take on every problem. You know, we're good doctors. We're going to solve everything for this particular patient. We're going to score great marks in the station. We're going to solve everything for her. So most of the people, what they do is they start making a game plan in their head. So what is the game plan? Okay, first I'll go for the acne. I'll tell her about the management for acne. I'll treat her for depression. I can give her this, 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 and that. Okay, third, I'll counsel her regarding her relations with her family and friends. I might, refer her to a psychiatrist as well, for sessions. And finally, the diet thing. Someone told her that her diet was not good. Her diet was the cause for her acne. Of course, that's not true. So I'm going to counsel her about her diet as well. Okay. So what you ended up doing was you tried to solve 5 problems all together and you failed at each and every single one of them. So you need to prioritize. Priority is a good thing. You should prioritize in life. You should prioritize in PLAB-2 in every station. So how do you get about it? You summarize that 1 minute or those 30 seconds if you're really good at speaking. If you're really good at speaking, it takes you 30 to 40 seconds. If you're not that good at speaking, it might take you 1 whole minute. So how do you do this? Okay, so let me just summarize. Let me just repeat everything we've discussed so far. So I might not have missed anything. Is that okay with you? Yes, doctor, that is okay with me. Okay. Okay, so you came to me with the problem of acne, and you told me that you have acne, and it's been a chronic issue. It's been a long-standing issue for a while now, and it has been affecting your work life. It has also been affecting your relations with your families, your friends. You don't go out that you might be going under some sort of depression. And someone also told you that it's your diet that might be causing this. Is that everything? Did I get everything? You confirm it from her. And in that 1 minute, what you did was you listed everything she's told you. She knows you were listening carefully. And when she knows, the GMC knows. So another point in your favor, another point towards you. You're a good listener. Congratulations. So now coming to the management. You have to say this one line that I really love. And that line is, okay, so there seem to be a lot of, things that you're dealing with here. We might not be able to get to everything this time. What we can do is I can, treat your acne at this appointment, and then maybe call you back in 1 or 2 weeks, and so that we may discuss everything else in a bit detail later. Would that be okay with you? Now you've played your ace. This is the best thing you could have done. You've prioritized. What is the priority? Her depression or acne, according to her? It might be her depression. It depends on her answers, really. Sometimes it's her depression. Sometimes it's the acne. But there is one thing that you studied, that you read when you were outside the station, and that was manage her acne. So the whole point is managing her acne. But at the same time, by summarizing this information and by letting her, letting her know that that she's been having all these problems, you realize it's been hard for her. And by summarizing it, you have told your examiners, you have told the patient and your examiners that you were listening. Number one, you were listening carefully. Number two, you plan on treating the patient fully, but you're going to do but you're going to do it in steps. Now, the first step you're going to do, according to your plan, according to your statement, is you're going to counsel her about her acne treatment. And you're going to call her back in a few weeks' time, in 2 weeks' time, 3 weeks' time, 4 weeks' time, depends on you. Just say a few weeks, it just sounds better. So you're going to call her back in a few weeks' time, and you're going to discuss how is the treatment affecting her life now. The major cause for her depression was her acne. That made her insecure. You're treating her acne, but at the same time, you're going to follow up on the depression part as well, alongside her treatment. That shows empathy, that shows care, and that shows extremely good management skills. You will not miss out on anything. You will get all the vital information summarized. If there was anything missing, you already asked the patient about it. Okay, if there was someone missing, you added that one extra line at the very end. Did I get everything, or did I miss something? Is that all? Is that everything? If you're missing something, she will add to it. And that is the beautiful part of this one liner. So take your 1 minute. This 1 minute will save you a lot of time in the management part. Because this is a particularly difficult station, I've told you this before, that in the station, she won't be willing to talk during the start. She will take her sweet time. Sometimes she might take 3 minutes to talk. Sometimes she might take 4 minutes to talk. Okay? So if you are going to manage her, it is going to be in steps. You cannot manage everything at once. You cannot manage everything in 2 minutes. No, it's not possible. What's going to happen if you're going to manage this in 2 minutes? What's going to happen is you're going to speak with, I don't know, Usain Bolt speed, and you're going to ruin everything for yourself and for the patient. The patient will not understand a single word you're saying, and you will fail the station. You will fail the management part and the IPS part because you did not acknowledge the patient. You did not summarize every problem you've heard from her. You did not, attend to every problem. What you did was you did the classic checkbox approach. Okay, history, check. Management, check. IPS, maybe. Let's check it just to be safe. And you leave the station all happy. I've completed the station, and the results come out, and GMC is like, no, brother, you have not passed the station. Okay. GMC is very cruel. Once you guys give your exam, you're going to realize GMC is very cruel. Anyways, so you are going to do this in sections. So you treat her acne, the standard treatment of acne, the guidelines. If they wanted to check you for guidelines, there was PLAB-1. I've told this in the last webinar as well, that PLAB-1 is an exam for knowledge. PLAB-2 is an exam of how you apply that knowledge. It is basically prioritizing. It's basically replicating a classic clinical environment where you have a patient come to you. They have many problems. Now, there are some problems that you're going to deal with first. There are some problems you're going to deal with later. There are some problems you're not going to deal with at all. You're going to refer for those problems. Okay? So it depends on the scenario. It depends on your situation. It depends on your judgment. It's basically your call. You're the doctor in charge. Okay. Let's move on. I hope this scenario is clear. I honestly, to God, hope this scenario is clear and this approach is clear, because this is a very important part of PLAB-2. And this will help you in each and every single station. Okay, so Another thing that students do in PLAB-2 is calling their senior. Okay, so imagine you have a patient and the patient has been on antihypertensives for a while now. And now the patient, what the patient wants to do is the patient has come to ask you whether he can stop taking the medication. Okay. If you are good doctors, you know that antihypertensives are for life. If you are bad doctors like me, you will call your senior. For this one single line, you will call your senior if you are anything like me. So the patient comes to you, he wants to stop his antihypertensives. He's been on those antihypertensives for the past 5 years. He's tired, of taking all these medications. He is going to ask you, doctor, now my hypertension should be controlled. My high blood pressure seems to be controlled. I've tried this. I've tried not taking my medication 2 or 3 days in a row, and that has not affected my blood pressure at all. My blood pressure seems the same. Okay. All right. So what you do is most of the people, what they do is they will start calling for their senior. Okay, this is a very important question. You're right. Normally the blood pressure medications are for life, but I'll go ask my senior after this. So, you can talk to my senior and he can confirm whether you need to continue taking your medications. This is a bad approach. Honestly, this is a very bad approach. You do not call your senior for every little thing. You are going to be an FY2, a foundation year 2. Foundation year 2s are expected to handle certain situations on their own. Imagine you're working in the NHS and you call your consultant, you page your consultant, what's the dose for ibuprofen? The consultant is going to kill you. Okay, so there are certain problems that you need to deal with on your own. Okay, and FY2 is expected to deal with little minor things on their own. So don't start calling your seniors for every little thing in the station. Okay, so this is basically the go-to response. That's why I wanted to talk about this so much. Anytime and in any station, every time, even during practice, even during mocks in different academies, I've seen students, going to their seniors for I don't know how to really say it politely, for the simplest things. Okay, that's polite. For the simplest things, I mean, ibuprofen dosage, I'll ask my senior and get back to you. Okay, doctor, when are my blood tests due? Oh, I'm sorry, I don't know about that. But what I can do is I can go ask my senior. I mean, is the senior Gandalf the Grey or Gandalf the White? Okay, there seems to be a multitude of imaginary seniors running around the hospital, and they're always available for FY2s. That does not happen in real life. Okay, so you need to be very careful when you're mentioning seniors. Only mention seniors where you think that you cannot solve a problem. Okay, when it's out of your pay scale, when it's too much for you. Simple as that. Okay, so that was another common thing people do. You should avoid this. Okay, so let's move on and let's discuss one more case, and after that we'll take some questions. So the station would be that imagine you're working as an FY2 in general practice. A 65-year-old man comes to you and he is a known case of diabetes mellitus type 2. He has come today for his annual review. Okay, so the diabetics, they get an annual review. It's it's on a fixed date every year. So what we do is we get their HbA1c levels, and then we call them back to the GP practice, and we discuss how their diabetic control is going. Okay, so now his HbA1c levels are 11. Okay, so that is too high. Could you guys just excuse me for 1 minute, please? Just give me 2 minutes. I'm very sorry. Just give me 2 minutes. Okay, sorry about that. Okay, so what were we talking about? Can everyone hear me? Okay, good. All right. So the patient has come to you. He's a 65-year-old male, and he has come to you for his annual review. And now his HbA1c levels are 11%. Okay, so that is quite high. As we all know, that is quite high. So how do you deal with this? And you've also noticed one thing. I'm just making up the scenario as we go, so don't hold it against me. I like to make different scenarios, and I like to make them as difficult as I can. The whole point is approach. I want to give you guys a general approach and not a script. For one particular station, I just want to give you guys an approach, a generalized approach that you can apply everywhere. Okay. So you also notice that the old man has not taken his medication for 6 months now. Okay. So you've not taken your he's not been taking his medication for 6 months now, and he is a diabetic patient. So the questions in your mind should be, why is he not taking his medications? I need to confirm that. I need to confirm whether he is not taking his medications. I need to listen to it from his own mouth. And the second thing, why? The more important thing is why. Okay, so the why is really important here. So how do you approach this station? This is another problem on problem kind of scenario. Okay, so you're going to ask him. There are two ways you can ask him about him not taking his medication. So the first part would be, okay, so I gather that you've not been taking your medication at all. I've read that from your the preliminary history that the FR1 has taken from you. It's either that, or it's either how are you taking your medications? Are you taking them regularly? do you like taking your medications? And he's gonna say no. No, doctor. Now, there might be a magnitude of reasons for him not taking his medications. It might be, he just doesn't like taking his medication. There is just poor compliance. Maybe sometimes the patients would come to you and tell you that, doctor, my blood sugar levels, they're not really being affected by my medication. I check them every day, they're normal. So that means I'm fine. Sometimes the patients do not realize that diabetes and hypertension are silent conditions. Now, what are silent conditions? Silent conditions, they do not exhibit any symptoms until they've been unstable for a long, long period of time. Okay? So the patient might tell you, doctor, I don't have any symptoms. Why should I keep taking medications? So in these kinds of scenarios, you need to realize that there are going to be a magnitude and multitude of problems. You're going to counter them all, but you're going to counter them in sections, in pieces, separately, one at a time. Now, there might be two approaches to cases like these. You might ask the patient, as I mentioned in the acne station before, after you're done summarizing, there are two ways this can go. Okay, one is where you're in control and one is where the patient is in control. Now, the one where the patient is in control, after summarizing, you're going to ask the patient, so these were all the problems that you've discussed. Okay, which one do you think should be discussed first? Okay, which one of these problems should you think we should solve first? Now that is obviously giving the patient control, and there is nothing wrong with it. But in a case where a person has come to you with uncontrolled diabetes, he's not been taking his medication for the past 6 months. After you're done taking a history, after you're done, pulling in your interpersonal skills, pulling in every bit of data gathering that you might have, you are going to manage the diabetes first, because this is clinically more important. And as the doctor, you are going to decide which issue is important. I would like to give the patient control, but I can see here that there is a clinical issue that needs to be addressed. So if there is a clinical issue that needs to be addressed that might endanger a patient's life, you deal with it first and you make the call. Otherwise, there is an option that you might let the patient make the call, and there is nothing wrong with that. Okay, so the patient might tell you a multitude of reasons, a magnitude of reasons, and the patient might also say, doctor, I don't have any symptoms, so why should I keep taking the medications? Okay, so you're just going to counsel the patient. This is a very standard counseling station. You're just going to counsel the patient. You're going to explain to him that diabetes is a silent condition. Most of the times, most of the patients, they do not develop any symptoms, but when they do, there are serious complications. They can attack your kidneys. The high blood sugar levels, they can attack your kidneys. They can attack your eyes. They can attack your blood vessels, and long-term damage can be done. So this is why we keep giving you medication for life, because as long as we control the blood sugar levels, you're going to be fine. There are less chances for you to get sick. Okay, so that's one approach. Another approach is the convincing of the patient. You need to convince the patient to take his medications. Now this is a very tricky part. Okay, so, okay, why don't you take your medication? Doctor, I just don't like taking medications. It's as simple as that. Even if you prescribe them to me, I will not take the medications. I just don't like eating tablets. I just don't like eating capsules. It's expensive. Although the NHS is paying for it, but it's expensive. There might be a magnitude of reasons. Okay, so what you do in these kind of scenarios, if the patient is unwilling to comply, if the patient is unwilling to understand, if the patient refuses to take medication at every level, you negotiate. How do you negotiate? You might offer them a reduced dose. Okay, that's no problem at all. You don't like eating medications. Okay, so I can see from your data that you're on multiple medications. So what I can do for you is I can reduce the dosage. You're only going to have to take one tablet every day. That's it. No more injections, no more of this, no more of that. We're going to send you to a diabetes clinic. We're going to request them that adjust your dose in a way that suits your lifestyle better. And about your diet, we can send you to the nutritionist. He can rearrange your diet plan for you, where you can eat more and still have less blood sugar level. He can put you on a healthier diet, maybe get a cheat day once in a while. you know you start negotiating with the patient. And there is nothing wrong with negotiating with the patient. That just shows that you're willing to help the patient. And in the long run, it's beneficial for the patient. No medication is very dangerous for the patient. Less medication, which you can raise every week or every 2 weeks and keep monitoring the patient, that just seems more reasonable. It's as simple as that. It just seems more reasonable. Okay. So what I used to do was I used to divide my PLAB-2, every station, into two halves. Okay. So what were the two halves? I used to divide the first half as the issues. I used to look at the issues. Okay, these are the issues. Then I wanted to go for the red flags. What are red flags? Red flags are things that you must ask about. For example, in the case of acne, while you're taking a history, you need to ask about certain conditions: menorrhagia, polycystic ovarian syndromes, okay, things that are associated with acne, diseases that are associated with acne, diseases that you need to rule out. These are what we call the red flags. Then you move on to the psychological impact of the said disease on her life, okay, on the patient. So how has this been affecting your life? I can see that you're stressed. How has this been affecting your daily routine, your daily life? Is everything okay? All right. So once you've done that, then you move on with the ice. The ice is integrated in here somewhere. Okay. So you've come with acne. Don't just go on asking the patient, what do you think you have? Cases, for example, if a patient comes to you with the chest pain or shoulder pain. Okay, so the patient has come to you with shoulder pain. He asks you, doctor, I have shoulder pain. And you ask him, okay, and what do you think this might be? Doctor, I think I've picked up, certain weights, and I think this might be due to that. Okay, okay. And are you particularly concerned about anything? Yes, doctor, my cousin had the same thing, and he was in pain for a long, long time. Okay, and what do you expect to do? What do you expect us to do for you today? Are there any expectations? Yes, doctor, I think my cousin got the MRI, so I'll get the MRI as well. This is not a good way to deal with the station. This is not a good way at all. All right. So what you can do in these kind of situation is you need to acknowledge the patient, but you need to keep the upper hand because you are the doctor. You can't just say, he's just going to say, okay, I'll get an MRI. You're going to say no, and just walk out of the station. That might give you 1 mark, 2 mark. That's not going to make you pass the station. You need to be very careful when you're dealing with these sort of things. So the patient comes to you with chest pain. Okay, I can understand that you're in pain right now. Would you like me to offer you some, would you like me to reduce your pain? How would you scale your pain on a scale of 0 to 10? 0 being the least amount of pain and 10 being the maximum amount of pain. Is the pain tolerable? Do you need something to dull the pain? No, doctor, I'm fine. All right, that's okay. You offered them painkillers. You started the station, you offered them painkillers. You dealt with the pain first. So, okay, before we move on, may I ask you a couple of questions? Yes, doctor, you may ask me a couple of questions. Okay, so how long has this been going on? You do the Odipara, sorry, you do the Odipara for the pain, and you move on with the history. Okay, and you also mentioned your cousin had the same thing. Yes, doctor, my cousin had the same thing. Okay, most of the times, what do you think it could be? It could be muscular. Yes, it could be muscular. Most of the times it is muscular pain that we deal with. We see these kind of pains in patients in clinics every day. Okay, so what do you think might be done? What do you think might be, what do you expect? Doctor, I'm expecting, my cousin got an MRI, so I should also get an MRI. Okay, that in some conditions, these kind of pain might end up getting an MRI, but let's just examine you first. And after examining, if you feel like you need an MRI, then we'll definitely go for it. But if not, it's just better, because the MRI has a lot of radiations, and we do not want to expose you to those radiations unnecessarily. Now, the same conversation, two different ways. The first one was simply box checking. Okay, I've taken the history, done. I've taken the management, done. I've taken the ice, done. I've done the ice, the management, the history, but I failed the station. Why did I fail the station? Because I didn't do the second approach. I did not actually do the station. I just treated the station like an exam, and you're not supposed to do that. Okay. Okay, that's pretty much all I have to say about this. So are there any questions? I think everyone's asleep. You can type in your questions, or you can just turn on your speakers.
Hi,
Thank you, Doctor.
doctor. Could you please tell us about the part where this psychotic patient keeps asking if the police is here? I couldn't catch that one.
Okay, so there is a case that has come many times in PLAB-2. It's about a schizophrenic patient, and this schizophrenic patient has been brought to your clinic or brought to the emergency department by the police. He had a weapon in his hand. He might have a knife, he might have some other sort of a weapon, and he will be brought to your clinic by the police for a psychological evaluation. Okay, so in this station, the patient has no history. He is just a random person that has been acting very odd, and the police has captured him, and they have come to you. So in this station, once you enter the station, the patient is going to be a schizophrenic person. He's going to be very quirky, and he's going to be very, very, very odd. So what he is going to do, once you start asking questions, he is going to announce that the police is after him. Everyone is conspiring against him, and the policemen outside the room are not actually policemen. They're his enemies. They're here to kill him. And even if they are the police, they're conspiring against him. This is a very common schizophrenic presentation. Okay, so he's what he's going to do is he's going to keep asking. He's going to assume that you as a doctor are in on it with the police. So he's gonna keep asking you that are you in on this? Are you in on this with the police? You're not really a doctor, are you? Okay, you're trying to kill me as well. You're gonna prove that I'm mad. You're gonna call me mad, and then you're gonna put me in the hospital where the police can come and kill me. Okay, so this is a very common station. What you need to do in the station is you need to develop a level of trust with this patient. So here I suggest that you bring in the confidentiality part. Okay. Okay, the police are outside, but I assure you that I will not tell them anything. Have you hurt anyone? Okay, do you have a weapon on you right now? Yes, I have a weapon on me. Okay, what kind of weapon is it? Okay, it's a knife. Okay, I would like to request you to put the knife on the table towards your right or towards your left, away from you, pointed away from you, and push it away. That ensures your own safety. You need to ensure your own safety. Okay, so once you've done that, he will be doing this. He will follow you on this. Once you've done that, okay, I would also like to tell you that anything we discuss in this room, I will not be able to tell the police, because I am a doctor, and as a doctor, I am bound by law to not tell anyone about our conversations. I cannot do that legally. The police will capture me as well. Okay. So this is how you develop trust with the schizophrenic patient. Then you start on taking the history, and then you start on assessing that how schizophrenic he really is. It's a very nice station. We'll discuss it, sometime later. Okay. Any other questions, guys? Okay, Dr. Umaima says, how would you deal a patient who is paranoid towards the medical staff Okay, how would you deal a patient who is paranoid towards the medical staff and doctors and sees the doctor as a danger to him or her? Okay, you can deal with this patient, Dr. Umaima, in 2 or 3 ways. The first way would be to talk really nice. Okay, this kind of scenario, honestly, this kind of scenario, I've never seen this kind of scenario in GMC, but I can tell you the generalized approach towards it. So let's assume that we have a patient who sees the doctor as danger. Let's assume it's a child, it's a 10-year-old or 11-year-old child, and he's afraid of injectables. And once you come near him, he starts screaming. He sees the white coat and he starts screaming. So in these kind of stations, what I suggest you do is, as a doctor, as a student, you're giving an exam, obviously, you might be wearing an overall. Okay. Most of the times you're not wearing an overall. But there might be some medical equipment there. There might be some sort of cues there. They will leave you with some sort of cues. Okay. And they will not leave you stranded that there is a patient, you go in and he starts screaming. No, that's not how this works. So there will be some sort of cues, there will be some props that the patient will say something as a trigger. The patient will say something as a clue. Okay. So imagine you go inside, it's a 10-year-old child and he starts screaming, no, no, I don't want the injection. I don't want the injection. I don't want the injection. So what you're going to do, you're simply going to reassure him. How you're going to reassure him? Okay. Hi, my name is Dr. Daniel and I'm not here to what seems to be the problem here? No, doctor, I don't want an injection. I don't want an injection. Okay, that's understandable. Everyone's afraid of needles. That's fine. I'm not going to stick any needle in you. Look at my hands. Look at my hands. They're empty. Do you see any needles on me? No, doctor, I don't. Okay, so I don't have any needles on me. I'm not going to put a needle in you. Okay, so you can calm down. All right. So this is the kind of approach you should go for. Okay, if a male patient is not comfortable to give information to a female doctor, should we offer for him to talk to a male doctor? Yes, you can do that, but that depends on the scenario. Like I said, if it's something very personal, very shameful, for example, he is a registered sex offender, or for example, he has a sexually transmitted infection. Okay, imagine the patient is male and you as a female doctor are taking a history and the patient has a sexually transmitted infection. So imagine you're telling him the reports now. Okay, so okay, let's assume his name is Mr. John. Okay, so Mr. John, I have your test results and would you like to hear them now? Would you like for me to call someone to stand next to you or sit next to you as I read the test results? He's going to be like, okay, doctor, you can tell me the test results right now. Okay, Mr. John, as you know, we took some blood samples from you, and according to your symptoms, we took some blood samples from you, and your results have come in, and you have tested positive for HIV, or you have tested positive for gonorrhea. Okay, the patient, you give them time to think. Okay, okay, doctor. Okay. Okay, are you comfortable talking to me about this? Or, can I call someone from your family? If you're not comfortable talking to me, I can call in a male doctor as well. We can rearrange this appointment. You can come back in another time and we can get you a male doctor if that's more up your alley, or if that's, more comfortable for you. Then normally I would not suggest doing this to a male, if I'm being very honest, because males they don't care. Mostly they don't care. Okay. Females have a certain sensitivity to them, especially in GMC. Uh, for example, it's a female patient, there is an STI, there's a sexually transmitted infection in a female patient. Obviously, going in, even as a female, even as a male, you're more careful on how to approach this than a male patient. Imagine you're working in your clinic. I'm talking about regular hospital life now. Even in my personal life, I'm working in a hospital. And if I have to give the diagnosis of a sexually transmitted infection to a male as compared to a female, uh, I am more careful talking to the female than I am while talking to a male. With males, you can really approach everything. But again, If the patient seems distressed, if the patient seems uncomfortable, he will give you cues. There will be physical cues, there will be verbal cues. And if you can pick on those cues, yes, you can definitely offer them. And would you like to talk to a male doctor? We can rearrange the appointment and you can come back in a few weeks' time and we can discuss your test results then. Okay. I'm always behind on chat somehow. Okay, any other questions, guys? Just say yes or no, guys. I mean, we're all here. Okay, so no more questions from the people. Okay, so if anyone has any other questions, they can either turn on their microphones or they can type. If not, just say no, let me leave. I'm tired. Okay, so I'm just gonna assume that nobody has any other questions. I would like to add one last thing. I just remembered it. Thank God I remembered it. Thank God for your sake. Let me just get this. Okay, yeah. One last thing I wanted to tell you guys that patient management, okay? There's a difference between the case you're presented with and the situation you're in. I will give the example of the Acne station. The Acne station is a station where you have many problems, okay? So that was a magnitude of problems. The case was she has depression. She has depression due to acne. She's not meeting her friends. She's not meeting her family. She's going to be kicked out of her job. Okay. What you need to do is you need to deal with the whole situation. And that is how we did that. We did that by sectioning the situation. Okay. So always look for the bigger picture, prepare well for your exams. And that's pretty much it. Thank you, everyone. I hope that's enough chatter out of me. All right, guys, stay safe, follow COVID SOPs. I'm working in COVID, so follow COVID SOPs. COVID is real. All right. Thank you so much for your time, everyone. Goodbye. Best of luck with your exams and best of luck with your preparations. Thank you.